Hello everyone, welcome back to my channel. Today the video is related to fundamental of nursing practice test 3. If you didn't watch practice test 1 and practice test 2, so I will give you the link in the description so you can watch both tests. I would also request you to like and subscribe our YouTube channel so you will get the notification once we upload the next test, practice test 4. Let's move to question number 101. A nurse is caring for a post-operative patient who suddenly become confused and restless. The nurse's first action should be read the four option. I will pause the video for 5 seconds and then you select the right answer. In this scenario, the correct option is option D. Assess oxygenation saturation and airway. You can also read the answer and rationale for each question which I give to you, and these are very important and essential. Let's move to the next question. Question number 102. A patient receiving IV vancomycin complains of redness and itching of the upper body during infusion. The nurse suspect. Read the four options. In this scenario, the correct option is option C, which is Redman syndrome. Let's move to the next question. Question number 104. I will bring this question down to the next page. So the question is, during auscultation, a nurse hears high-pitched whistle sound when the patient exhales. This indicates the answer is on option B, wheezing. Let's move to the next question. Question number 4. A patient on low sodium diet choose canned soup for lunch. The nurse should. What the nurse will recommend in this situation, the correct option is option A. Explain that canned soups is high in sodium. Let's move to the next question. Question number 105. A nurse observes a patient's a walker for the first time. A nurse observes a patient using a walker for the first time. The correct technique is, the correct option is option B. The walker moves first, then the weaker leg, then the stronger leg. Let's move to question number 106. A patient reports dizziness while standing. The nurse should first. The correct option is option C. Check blood pressure for orthostatic changes. The next question is, patient's NG tube has 300 ml residual. The next nurse action is, in this scenario, the correct option is option B. Hold feeding and notify the physician. Question 108. A nurse observed a patient with a right-sided weakness after a stroke. The nurse should. Correct option is option A. Place the caul right on the left side. Question number 109. A patient reports burning sensation while receiving IV potassium. The nurse should. The correct option is option C. Stop the infusion immediately. Question 110. A patient with a CHF, congestive heart failure, has gained 3 kg in 3 days. The nurse suspect. The correct option is option C. Fluid retention. Until 1010, I would like you people can share your score in the comments box. So in this way, I can see that how you are scoring for so far. If you're scoring between 7 and 10, it's mean you are on the right track. Let's move to the next question. A patient on a clear liquid diet may consume. The correct option is option D, which is chicken broth. The next question, 112. A patient taking warfarin asks which food to avoid. The nurse should advise. What the nurse will advise in this scenario? The correct option is option C. That's green leafy vegetable. The next question, 113. A patient develops crackle in both legs after receiving IV fluid. This may indicate. Read the option. This scenario, the correct option is option D, fluid overload. Next question is, a nurse teaching a diabetes patient about hypoglycemia prevention should include. Which one is the correct option? Option D is the correct option. Carrying a glucose source at all time. Let's move to the next question. Question number 115. A patient with COPD is short of breath when lying flat. The nurse document. What the nurse will document? Option D, orthopnea. The next question is, a patient's complaint of numbness and tinglings after starting a loop diuretic. The nurse should. What the nurse will check? Serum potassium level. Option D is the correct option. Let's move to the next question. A patient on morphine report respiratory rate of 8 beats per minute. The respiratory rate 8 per minute. The nurse should. What the nurse will do in this situation? The correct option is option C. Hold medication and assess airway. Move to the next question. Question number 118. A nurse notes redness and swelling at IV site. A nurse notes redness and swelling in IV site. The proper action is. Read the 4 option. I will pause the video for 5 seconds. In this scenario, the correct option is option B, which is stop infusion and remove IV line. Next question is, a patient reports fatigue and failure. Laboratory result shows hemoglobin 8. The nurse suspect. Correct option is option C, anemia. A patient on insulin report dizziness and sweating. The nurse should. What the nurse will do in this situation? The correct option is option D, which is give fast acting carbohydrate. Question number 121. Again, I would like everyone to share your score in the comment section. Question number 121 is, a nurse teaching safe embolation should advise. What is the correct option? The correct option is option B. Keep the load close to the body. The next question is question number 122. A patient's skin turgor is full. The nurse suspect. Clear indication of dehydration. The next question. Patient reports nausea after taking an opioid. The nurse should. The correct option is option B. Administer antiemetic is prescribed. The next question is during cardiac assessment, the nurse hears an extra heart sound after S2. This is likely. Correct option is option D, S3 Galoof. Question number 125. Patient taking corticosteroid long-term should be monitored for. Correct answer is immunosuppression. Question number 126. A patient reports poor appetite and unintentional weight loss. The nurse should assess. The correct option is option A, nutritional status. Next question. 127. A patient with a CKD, chronic kidney disease, is advised to restrict. The correct option is option B, potassium-rich food. Question number 128. A nurse is checking a patient's radial pulse. The correct technique is. In this scenario, the correct option is option A, palpate with the pads of finger. Let's move to the next question. A patient receiving TPN suddenly develops chills and fever. The nurse should. It's the correct option. Read carefully each option. In this scenario, the correct option is option B, stop the infusion and notify the physician. Let's move to question number 130. My apology, I show you the correct answer for this one. Anyway, a nurse notes fetal pulses in a patient on a diuretic. The nurse should. The correct option is measure the daily weight. Let's move to the next question. A patient with a nausea taught to eat. What to eat in these four options? The correct option is option C, small frequent meal. Question number 132. A patient taking digoxin report nausea, vomiting, and visual changes. The nurse should. Read the four options. The nurse should hold the medication and notify the physician. Question number 133. The nurse is assessing bowel sound and hears none for 5 minutes. The nurse suspects. The correct answer is option B, paralytic ileus. The next question. A patient is on low sodium diet. Ask about seasoning foods. The nurse should advise. The correct answer is option A, use herbs and spices instead of salt. Question number 135. A patient report tinglings around the mouth after taking calcium channel blocker. The nurse should. The nurse should assess for hypocalcemia. Option A is the correct option. Let's move to question number 136. A nurse observes a patient's nails are clubbed. This may indicate. Option A is the correct answer, chronic hypoxia. Let's move to the next question. Patient receiving IV antibiotic develops diarrhea with abdominal cramp. The nurse suspects. Option A, C. difficile infection. Let's move to the next question. A patient on loop diuretic report muscle cramp. The nurse should check. The correct answer is serum potassium. Let's move to the next question. Patient with burns is prescribed a high protein diet. The rationale is. Correct answer is option B, promote horn yelling. Let's move to the next question. My apology again. I show you a little bit part of answer. A patient receiving enteral feeding has a residual of 300 ml. The nurse should, in this situation, the correct option is option B, hold feeding and notify physician. Move to the next question. A patient on a clear liquid diet ask what they can drink. The nurse should recommend option D, clear broth. Let's move to the next question. Question number 142. A patient on anticoagulant asks which activity is risky. The nurse should advise. The correct option is option B, contact sports. Let's move to the next question. A patient receiving corticosteroid report increased thrust and urination. The nurse should increase thrust and urination should be your keywords. In this situation, the correct option is hyperglycemia. Option B. Let's move to the next question. A patient report orthostatic dizziness. The nurse should read the four options. The correct option in this scenario is option B. Measure blood pressure while sitting and standing. Next question is a patient receiving opioid reports constipation. The nurse should. The correct option in this scenario is option B. Encourage fluids and fiber. Let's move to the next question. A patient shows signs of fluid overload. The nurse notes. The nurse notes. The correct option is crackle, edema, and weight gain. Let's move to the next question. A patient taking iron supplement should be taught to. Scenario, the correct option is option D. Take with the orange juice to enhance absorption. Question number 148. A patient receiving antibiotic develop white patch in the mouth. The nurse suspect. The correct option is oral thrush, which is option B. Let's move to the next question. 149. A nurse hears a low-pitched snoring sound over the lung. This is the correct option is Ronchi. Option C. The last question of today vlog or video is a patient receiving IV potassium develop burning at the site. The nurse first action is, this is the repeated question, and I'm sure that you will answer this question. The correct answer is option A, stop infusion. Thank you so much for watching this video. If you didn't subscribe my channel, so I would like to request everyone to like and subscribe our video or YouTube channel so you will get the notification once we upload the next practice test for fundamental of nursing. Thank you so much and have a nice day.